Thank you, Mr. Chairman, and thank you to the witnesses for your thoughtful testimony. Again, I'm also somebody who can say that I spent 20 years as a small employer, and like the chairman and the ranking member, definitely acknowledge that there's realities there in terms of that end of the market that we should always be focused and working on. Last Congress, as Mr. Desaulnier mentioned, we actually came together on a bipartisan basis to have the transparency in the pharmacy benefit managers, which again, small business community supported strongly because that black box of how prescription drugs are negotiated is unacceptable in terms of really trying to make sure that the customer, which is businesses who are buying these health plans, understand where their dollars are going. And large companies like Boeing, as part of their contracts with PBMs, required full transparency. And because of that, a lot of them didn't bid on their offering. And but the ones that did, Boeing saved millions of dollars because of just the fact that they could be able to see what happened. Unfortunately, the bill was pulled during the lame duck session at the behest of the Trump transition team. And again, Speaker Johnson had signed off in terms of the legislation, and unfortunately it got withdrawn. We're going to start again because that's getting to the core costs of health care has got to be part of the plan here in terms of how you lower premiums. If you don't do that, then everything you're doing is just cost shifting. It's whack-a-mole, and that's just not going to work. And speaking of moles, Mr. Desaulnier mentioned the $880 billion cut to Medicaid, which is not a mole. That's like a gorilla that is going to, again, have ripple effects to the employer community. Mr. Chairman, I have a list of the 50 major healthcare provider groups that have come out opposed to the $880 billion cut. And again, it deals with the high-end providers, the American Hospital Association, Catholic Hospital Association, Children's Health Association, physician groups, patient groups that have all come forward and recognize the devastating impact this is going to have for access to care. And I ask that this list be unanimous consent to be added to the record.
Without objection.
So again, if that goes through, we're looking again at a program that provides 40% of the live birth coverage in America for babies and mothers. Again, it's about 45% of children are covered. Some are actually working families because Medicaid provides for coverage. Again, Ms. Lilly, maybe you can talk about that. That's part of the solution in terms of helping with employers to have options.
I will say, just to start off, that I think having cancer is incredibly expensive. Anyone in our community who has had cancer can tell you that. And for a lot of kids, as you said, Medicaid is either their source of coverage, or it comes in as a secondary source of coverage when their parents realize exactly how expensive this is going to be. Children's hospitals across the United States, I'm sure they're on your list because they are one of the largest recipients of Medicaid funding. So when our kids end up in these children's hospitals that have the necessary specialized care, Medicaid is often the program that is picking up the tab there. I will say, I also think a lot about caregivers. If you are, say, a mom or a dad who has had a kid diagnosed with cancer, and that kid is in the hospital for months or weeks on end, you may not be able to maintain your job. You may not have access to paid leave. You may not be able to do that. And so you also need health insurance. If something additionally awful were to happen, you would also need that health insurance. And Medicaid also picks up those families. Medicaid is also incredibly important for people with disabilities, and many people deal with the long-term implications of having a cancer. So for instance, I know you have personal experience with this, sir, but if you have been through that chemo, if you have been through that radiation, if you have been through, frankly, the treatments that we still need to develop better options for, those can have really long-term implications on your health, and you may need access to long-term services and supports, which are only available through the Medicaid program. And so really, Medicaid kind of comes around all cancer patients and really helps all of that. I will add that I think in addition to caregivers and kids, and people with disabilities, you also have a lot of older adults on Medicaid, and that's actually one of the biggest populations of people with blood cancer are older
60%.
adults.
Right. Thank you. I yield back.